Hello, friends. Today I'm going to talk to you about a very heavy but relevant topic to everyone. How outrageous is the US healthcare system? Many people may think that as a developed country, the United States should have very good healthcare resources, but this is not the case. According to a recent report by World Population Review in July 2025, 66.5% of all bankruptcies in the United States are surprisingly caused by medical bills. What's even more shocking is that 72% of these people are actually insured. Speaking of which, you may be wondering, if you have insurance, why would you still go bankrupt because of medical bills? That's the core question we're going to delve into today. In the United States, insurance is not an umbrella at all. Instead, it is very often the last straw that breaks the back of the average family. Why is this so? Let us first look at the structure of the healthcare system. The health insurance market in the United States is highly fragmented, and most ordinary people buy economic health insurance. The deductibles of this kind of health insurance are very high, often amounting to thousands or even tens of thousands of dollars. Only when medical expenses exceed the deductible does health insurance begin to pay. All expenses up to the deductible are fully covered by the individual. In addition, the coverage of health insurance is also very limited. Non-cooperative hospitals are not reimbursed for consultation fees. Drugs outside the health insurance catalog need to be fully paid out of pocket. And even many complex surgeries have an out-of-pocket expense ratio of up to 30% or more. And the out-of-pocket expense ratio for special treatments may even be more than half. What is even more unreasonable is that there are many complicated bargaining mechanisms between health insurance companies and hospitals. Partner hospitals can enjoy discounted prices, while non-partner hospitals charge at a marked price. However, this marked price is often several times the actual cost. Patients are unable to find out in advance whether they are covered by their health insurance and how much they will have to pay in the end before they go to the doctor, only to find out when they receive the bill that the amount has long exceeded their affordability. Apart from the problems with the health insurance system, the collection mechanism for medical bills is also very inhumane. After many people are unable to pay the high bills, they will receive collection notices from hospitals or third-party collection agencies. If the bill remains unpaid for a long time, the amount of the bill will continue to increase due to late fees and charges. Some bills that started out at $10,000 can go up to $15,000 or more in 6 months. Even more outrageous, some states allow hospitals to garnish patients' wages through legal proceedings, up to a quarter of their monthly salary. This adds insult to injury for families already in financial trouble. Women make up a whopping 58% of those who go bankrupt due to medical bills, which is related to the fact that women are often required to take on the medical responsibilities of their families, as well as the precariousness of some women's part-time incomes. In addition, the middle-aged group of 35 to 55 years old is the hardest hit. This age group is easily overwhelmed by medical bills as they have old and young children with strong medical needs, while at the same time facing the pressure of competition in the workplace and income growth. These data show that it is no accident that medical bills have become the main cause of bankruptcy, but rather the result of a confluence of multiple problems with the U.S. health insurance system, healthcare pricing mechanisms, and the income structure of society. The next thing I want to talk to you about is the problem of unexpected medical bills, which is very common in the United States. According to a February 2025 report from the Centers for Medicare and Medicaid Services, 41% of insured adults have received an unexpected medical bill. Unexpected medical bills are bills for unanticipated costs that are completely unforeseen before a visit to a doctor and then suddenly received after the visit, and are centered on the fact that the price of healthcare in the U.S. is highly opaque. In the U.S., it is virtually impossible for patients to obtain accurate information about the price of medical services before seeking treatment. Even for the same item, charges can vary greatly from hospital to hospital and even from department to department within the same hospital. However, hospitals and insurance companies do not usually provide this pricing information to patients on their own initiative, and patients often need to receive their bills before they can learn about the costs. For a simple blood test, a community hospital may charge $85, while a large tertiary care hospital may charge $320. Patients simply cannot anticipate this difference when they seek medical care and are only shocked when they receive their bill. 2/3 of those who receive unexpected medical bills worry that they won't be able to afford them, reflecting a deep anxiety about health care costs. According to the Centers for Medicare and Medicaid Services, the average amount of an unexpected medical bill is $13,000, while the median annual income for the average U.S. family is about $58,000. To pay a bill of $13,000 would require almost 3 months of savings. However, 40% of U.S. households can't even come up with an emergency fund of $400, let alone deal with an unexpected expense of that magnitude. And because of this, many people are afraid to go to the hospital even if they are not feeling well. According to the West Health Gallup June-August 2025 survey, 33% of adults delayed seeking medical care because of the cost, and 28% even gave up on seeking care outright. Many respondents said that even though they knew they might need some tests, such as chest pains or hidden back pains, they chose to tough it out for fear of not being able to pay their bills, just in case they couldn't afford to pay them when they came down, which could even result in a mortgage on their house. This fear of poverty due to illness has become the norm for many of the American public. To make matters even more brutal, 30% of respondents said they had to choose between paying their medical bills and buying basic necessities like food and shelter. A special survey by the U.S. Bureau of Labor Statistics in the third quarter of 2025 confirms this. Many families have no choice but to cut back on basic expenditures after receiving large medical bills. And it's not just low-income families that are affected. The middle class is hardly immune either. The American Hospital Association's 2025 report shows that 38% of middle-class families with annual incomes of $80,000 to $150,000 have received unexpected medical bills, and 22% of those families have experienced short-term financial distress as a result. In addition, unexpected medical bills can have a significant impact on a patient's mental health. According to a survey conducted by the Patient Advocate Foundation, 68% of respondents who received unexpected medical bills experienced emotional problems such as anxiety and depression, and some even had suicidal thoughts. Therefore, the plight of medical treatment caused by unexpected medical bills is not only an economic problem, but also a social problem and a public health problem. It not only jeopardizes the physical health of patients, but also undermines the stability and harmony of society. In addition to unexpected medical bills, the problem of hospital charges in the United States is also very outrageous. According to a study report in the Journal of the American Medical Association Surgery in September 2025, the average American hospital actually charges $300 for every $100 of cost, and that is still the median. 10% of hospitals charge more than 8 times their costs, and the 50 hospitals with the highest charges found in the survey charge a median of 13 times their costs. For example, some private investment hospitals in Pennsylvania charge as much as $1,750 per $100 of cost, a ratio of more than 17 times. And some metropolitan teaching hospitals in New Jersey charge $1,443 per $100 of cost, one of the highest rates in the nation. There is a clear timeline for the spike in hospital charge ratios. A comparison of historical data from the Centers for Healthcare and Medicaid Services with the most recent study in 2025 shows that in 1999, the average U.S. hospital was charging only $200 for every $100 of cost. Since the financial crisis of 2008, charges have begun to climb rapidly, reaching $300 in 2010. In 2020, following the new Crown outbreak, charges rose to $450 at one point. Despite the median falling back to $300 in 2025, the gap between high-fee hospitals and regular hospitals is widening. This divergence in charges has much to do with the trend toward monopolization and the nature of ownership in the U.S. The 2025 study found that 74% of high-cost hospitals were privately owned, and most were metropolitan teaching centers with a high number of beds. These hospitals hold dominant pricing power by virtue of brand strength and resource monopolization. In terms of monopolization trends, in 1994, only 37% of the nation's hospitals were affiliated with large medical groups, while the remaining 63% were independently owned and operated. And competition in the marketplace was sufficiently high that hospitals did not dare to arbitrarily raise prices. But by 2024, the percentage of hospitals affiliated with medical groups has risen to 70%, with more than two-thirds of hospitals controlled by a handful of large groups. Because of the lack of competition, medical groups can set their rates at will, and patients have no choice but to passively accept high prices. Pennsylvania and Florida have been hardest hit by high-priced fee-for-service hospitals, which is closely tied to local demographics and hospital ownership structures. According to the U.S. Census Bureau's 2025 data, Florida has 22.1% of its population over the age of 65, making it one of the 5 most aging states in the U.S. Pennsylvania also has 18.8% of its population over the age of 65, which is the 8th highest in the nation. Elderly people are high-frequency users of healthcare services and have a very rigid demand for healthcare services. And both states have a significantly higher percentage of privately invested hospitals than the national average, and such hospitals are more inclined to make profits by raising their rates. For example, the Regional Medical Center in Florida charges $1,160 per $100 of cost, with more than 60% of its patients being elderly, and the St. Louis Medical Group in Pennsylvania has more than 70% of its patients being elderly, and charges a rate as high as $850. This practice essentially capitalizes on the rigid needs of elderly patients to make a profit, since seniors mostly rely on Medicare, which is not paying enough. This further forces hospitals to raise their rates, thus creating a vicious cycle. More notably, a recent study in 2025 found that high-billing hospitals instead have worse healthcare outcomes, with significantly higher rates of patient mortality, complications, and readmissions within 30 days. The trend toward monopolization of hospitals is not unique to the healthcare industry. Many industries in the U.S. have similar problems. For example, in the banking industry, after the financial crisis in 2008, the top 5 banks in the United States increased their share of assets from 30% to 55%. In the arms industry, a few large arms companies, such as Lockheed Martin and Boeing, account for more than 90% of all arms orders in the United States. This monopoly pattern of a few dominant companies allows companies to control prices at will, and consumers can only be forced to accept high-priced products and services. And the monopoly in the medical industry is even more harmful. After all, medical services are directly related to people's lives and health. High-priced medical care will not only increase the financial burden of the people, but also may deprive some low-income groups of the right to obtain basic medical services. According to a report by the U.S. Department of Justice 2025, the monopoly in the healthcare industry brings more than $550 billion in additional expenses to the American people every year, a cost equivalent to more than half of the U.S. annual defense budget. Many people may think that since hospitals charge so much, they must be very profitable. But in reality, the profit structure of the U.S. hospital industry is very uneven. According to Kaufman Hall's March 2025 Hospital Flash Report, the U.S. hospital industry's annual revenues have continued to grow, exceeding $150 billion in 2024, and operating margins rebounded significantly in January 2025, reaching a median of 4.4%, the highest level in more than a year. In 2024, monthly hospital margins typically fluctuated between 1.3% and 2%. In January 2025, margins improved sharply due to higher inpatient volumes and slower cost growth. Margins vary significantly between hospitals of different sizes. Large hospitals with more than 500 beds had an average margin of 11% in January, compared to 6.1% for hospitals with 26 to 99 beds. And smaller hospitals with fewer than 25 beds remained in the red with an average margin of -3.8%. Therefore, the previous view that the profit margin of hospitals has been negative for a long time is not accurate. In fact, large hospitals have realized high profits by virtue of their scale advantage and resource monopoly. while small hospitals are facing operational difficulties. Despite the improved profitability of some hospitals, the problem of Medicare underpayment persists. The Medicare Trust Fund report, released in June, shows that the Medicare Hospital Insurance Trust Fund is projected to run out of reserves in 2033, 3 years earlier than the 2024 report's projection of 2036. The Medicare Trust Fund is expected to run out of reserves in 2025, 3 years earlier than the 2024 report's forecast. This is largely attributed to higher than expected spending on hospital services. The report also notes that Medicare payments to hospitals continue to be lower than actual costs. In 2024, hospitals will be reimbursed only 89 cents for every dollar spent on services for Medicare patients. While this is an increase from 84 cents in 2020, there is still an 11% funding gap. This deficit is even more pronounced for public and small hospitals that receive a large number of Medicare patients. Some public hospitals with more than 60% of their Medicare patients have annual deficits in the tens of millions of dollars. In addition to inadequate Medicare payments, hospitals face cost pressures in other areas. The first is rising drug prices. 2025 January data show that drug prices continue to be a major source of cost growth for hospitals, even though the rate of increase has slowed significantly. Second are Medicaid payment delays. The May 2025 report shows that hospitals in at least 10 states are facing delays in Medicaid supplemental payments from the federal government, with some delays dating back to the fall of 2024. 2025 hospitals are also facing delays in Medicaid payments. This has led some hospitals to suspend service expansions, delay payments to providers, and even lay off staff. Additionally, the pickup in inflation in 2025 has taken a toll on hospital operations. The Consumer Price Index rose 0.5% monthly and 3.0% annually in January, which has resulted in higher labor and material costs for hospitals. It's worth noting that the parent companies of healthcare groups are often able to reap lucrative profits. For example, HCA Healthcare, the largest healthcare group in the United States, has a net profit of $3.5 billion in 2024, with a profit margin of 8.8%, much higher than the average profit margin at the hospital level. This model of large hospitals making profits, smaller hospitals losing money, and the group's parent company making high profits essentially shifts cost pressures to patients and primary care providers. Healthcare group executives take home high salaries. For example, the HCA Healthcare is paid $29 million in 2024, more than 500 times the annual salary of the average nurse. This unfair distribution of profits further exacerbates the chaos in the U.S. healthcare system. To address the opacity of healthcare pricing, in September 2020, President Trump signed an executive order on hospital price transparency, which was renewed by the Biden administration. In February 2025, the White House issued a further executive order requiring hospitals and insurers to disclose actual prices, rather than estimated prices. Steps were also taken to achieve price comparability across institutions. The Centers for Insurance and Medicaid Services (CMS) also updated its enforcement policy in tandem, with plans to implement more systematic monitoring and enforcement measures. In terms of policy design, all these initiatives aim to safeguard patients' rights to information and choice. However, in the actual implementation process, there are still many compliance issues. According to the most recent data released by the Centers for Healthcare and Medicaid Services in August 2025, some hospitals are still not fully compliant, despite the full rollout of compliance tools. The main issues center around irregularities in the format of machine-readable documents and unfriendly price displays for shoppable services. However, compared to the compliance rate of less than 1/4 of hospitals across the U.S. in 2023, the compliance rate of hospitals in the first half of 2025 has increased to 65%. Significant differences remain between hospitals of different sizes. Large teaching hospitals have a compliance rate of 82%, compared to only 45% for small community hospitals. As of August 2025, the Centers for Healthcare and Medicaid Services has taken enforcement action against 120 hospitals for serious violations, with fines of up to $2 million. far exceeding the previous $109,500 in fines. Of these, 45 hospitals have been placed on a priority watch list for persistent violations. Nonetheless, some hospitals are still circumventing regulation through yin and yang pricing. This means that publicized prices are much higher than actual charges. While actual charges are only disclosed to insurance companies and patients are not informed of the true discounted price, which results in the original intent of the price transparency policy not being fully realized. The core reasons for the challenges in implementing the policy are the bundling of interest chains and the difficulty of regulation. Lobbying expenditures in the U.S. hospital industry have been consistently high, reaching $29 million in 2024, ranking in the top 10 of all industry lobbying expenditures. These lobbying groups influence politicians' decisions by providing them with campaign funds, organizing events, and so on, thus impeding the implementation of policies that are detrimental to hospitals. Data show that the U.S. hospital industry provided $130 million in campaign funds to federal politicians from 2023 through 2024, with 70% of that money going to members of the Senate Finance Committee and the House Fundraising Committee, who have a significant voice in healthcare policymaking. In addition, the complexity of healthcare pricing makes it more difficult to regulate. Hospitals charge for thousands of items with complex coding. Even with publicly available compliance pricing information, it is difficult for the average patient to quickly understand and effectively compare. This further undermines the practical effect of the policy. Regardless of how the policy is adjusted, it is the average wage earner and insured who ultimately bear all the cost pressures. The American Hospital Association's 2025 report makes it clear that federal payments for Medicare and Medicaid remain below actual costs. The uninsured pay very little, if anything at all, and the rest of the costs need to be covered through other sources. The underpayment of Medicare and Medicaid has resulted in hospitals losing money on services provided to these two groups of patients. In order to make up for these losses, hospitals have had to raise the cost of care for the general population. The most recent data available for 2025 shows that hospitals are still losing $78 billion annually for Medicare patients and $26 billion for Medicaid patients, for a combined loss of $104 billion. All of this loss is passed on to the average patient through inflated charges. Second, the problem of underpayment by the uninsured further exacerbates cost shifting. According to the U.S. Census Bureau's 2025 data, 24 million adults in the U.S., or 7.8% of the adult population, are without health insurance. While this percentage is down from previous years, the size of the uninsured's arrears continues to grow. The Commonwealth Fund's September 2025 report shows that 55% of uninsured adults have medical bill payment problems or are paying off medical debt. In 2024, the amount owed by the uninsured to U.S. hospitals amounted to $45 billion. And hospitals have no choice but to spread this cost across the general population in order to recoup it, which leads to further increases in the cost of health care for the general population. The cost of uncompensated care in hospitals is also ultimately borne by the working class. According to the American Hospital Association 2025, hospitals' uncompensated care services, including free visits and patients' unpaid medical bills, account for about 5.8% of the average hospital's costs, which amount to about $40 billion, while the government subsidizes only 10% or $4 billion of this cost. Thus, the remaining $36 billion shortfall still needs to be made up through higher medical and insurance costs. Insurance companies will have to raise insurance premiums in response to high hospital charges. According to a November 2025 survey by the Kaiser Family Foundation, the average annual premiums for employer-sponsored health insurance in 2025 were $9,325 for single coverage and $26,993 for family coverage, representing increases of 5% and 6%, respectively, compared to 2024, far outpacing inflation of 2.7% and wage growth of 4%. The sharp rise in premiums further increases the financial burden on working families. Many working families have had to cut back on other expenses in order to pay the premiums. What is even more frustrating is that wage earners not only have to bear the burden of rising healthcare costs and premiums, but also have to finance the government healthcare system through taxes. According to the 2025 Medicare Trust Fund report, the U.S. federal government is spending $1.3 trillion on Medicare and Medicaid, which is largely funded by personal income and payroll taxes and ultimately borne by ordinary taxpayers. In other words, wage earners not only have to pay high health insurance premiums, but also pay high taxes, and at the same time, they also have to bear the out-of-pocket portion of their medical bills, becoming the triple bearer of the cost of the healthcare system. In contrast, seniors on Medicare, low-income groups on Medicaid, and the uninsured who avoid paying their share of the bill have no or very little cost to bear. And this inequitable distribution of costs is the root cause of the resentment felt by America's working class. According to a West Health Gallup survey at the end of 2025, 47% of the American public is concerned about not being able to afford necessary future healthcare costs. And 15% of adults say healthcare costs put a great deal of stress on their daily lives. This percentage nearly doubles from 8% in 2022. Many working-class people say it's just not fair that they have to pay for someone else's healthcare costs when they are busting their asses working 2 or 3 jobs to put their kids through college and pay rent. The problem with the U.S. healthcare system is essentially a game of shifting costs and responsibilities. Politicians promise to expand health insurance benefits in order to get votes. Hospitals jack up their fees in order to make a profit. Insurance companies raise premiums in order to make a profit. And in the end, all of the pressure falls on the average working-class person. Today, I have talked to you about the chaos of the U.S. healthcare system. Not to negate anything, but to let you know that behind a seemingly perfect healthcare system, there may be a lot of injustice and helplessness hidden. Medical care should be a basic need to protect everyone's life and health, and should not become a tool for a few people to profit, let alone a heavy burden that crushes ordinary families. I hope today's sharing can give you a clearer understanding of the U.S. healthcare system. You're also welcome to leave your thoughts in the comments section. And don't forget to like and subscribe if you found today's sharing helpful. We'll talk about more noteworthy social topics next time. See you soon.